Hi, Dr. Heather Rogers here. Today we're going to talk about the difference between melasma and sunspots. Those are both things that get worse in the summertime, and I want you to know how to take care of them. So let's talk about sunspots first. Sunspots are also known as liver spots, age spots, and they are brown spots on your face. They're usually pretty big, meaning a ½ inch to 2 inches in size. They're flat, and once they show up, they stick around. They may fade in the winter, but then they'll darker down again the next summer. The best way to not get sunspots is to not spend so much time in the sun. I know, I'm a dermatologist. I take away your favorite thing, but ideally you would wear sunscreen every day, and then you won't make as many sunspots. Once you have the sunspots, to lighten them up, there are multiple things you can do, and a lot of those are the things I want you to do anyways, which is vitamin C antioxidant serum in the morning, an evening treatment at night, which can have retinol in it, tretinoin and glycolic acid. Bakuchiol, something that's going to promote cell turnover. That's your morning and evening activity. There are bleaching agents that can really lighten brown spots, the most famous of which is hydroquinone. I personally think it is safe to use intermittently. I use it on my skin and I do prescribe it. It is not something that you can use all the time. It's something your skin needs to have breaks from. Outside of hydroquinone, topical tranexamic acid has also gotten very popular for lightening the skin. And outside of that, there's a whole bunch of herbal supplements that can do a little bit, but the ones that are going to do the most for you are sunscreen, vitamin C, something that promotes cell turnover at night, and topical hydroquinone. In regards to things we can do at the doctor's office, we can laser off age spots. That doesn't mean they're going to go away forever. It means they're going to be lighter for a period of time. And that period of time depends on how good you are at using sunscreen and staying out of the sun. But in my office, we will treat sunspots with IPL, intense pulse light, with resurfacing, and that can be clear and brilliant, it can be Fraxel, it can be the CO2 laser. All of those are gonna really help with your brown spots. Now let's talk about melasma. Melasma is also brown patches on your face that get worse in the summer and get better in the winter, but they're caused by the sun and hormones, meaning elevated estrogen and progesterone. This is something that women get when they're on the birth control pill, when they're pregnant, or when they're on hormonal replacement. It is incredibly frustrating. Data suggests that up to 1 in 4 women suffer from melasma, and we all hate it. The good news is usually when you go through menopause, if you're on hormone replacement, your melasma will get better, but up until then, it can be a real battle for people. So all of the things I told you to do for sunspots, you have to do even with more sort of aggro protection with melasma. So really my patients with melasma have to reapply their sunscreen religiously. You need to have sunscreen with at least 15% zinc in it, and you really have to stay out of the sun. In addition, melasma can be made worse by heat. So even if you're under an umbrella and direct sun isn't hitting your face, you might still get brown on those sunny trips because your skin is warm and you make more pigment. The other important thing to know about melasma is because heat can make it worse, lasers can make it worse, in particular IPL. So if somebody has melasma, I will not use intense pulse light on them, but I will use very, very low settings with resurfacing the clear and brilliant. So something that's not going to build a lot of heat in the skin, just promote a little bit of cell turnover. The other thing that has been shown to be helpful for some people with melasma is oral tranexamic acid. And this is something that is pretty safe unless you have a history of blood clots. And it really will clear up your pigment, not by itself. It will be something you will need to do with all of the other stuff, the vitamin C, the hydroquinone, the sunscreen, going off your birth control. But the add-in of tranexamic acid can really settle things down for people, but also it's not something you can be on forever, and some people do have a rebound effect when they go off of it. So that was a huge amount of information. Save this, watch it again, let us know if you have any questions, and I hope that helps you get through the summer.